Well, good afternoon, everyone. I'm Basil Sagos, DC Commissioner. Good to be aboard with you all today. Of course, I've got Dr. Jim McDonald on, DOH Commissioner as well. Happy to talk with you today about the air quality situation. Governor Hochul has advised DEC and DOH to provide an update on this forecast, and of course to discuss the looming air quality impacts facing New York. First on Canada. We have a brief update on the wildfire so we understand and level set as to the causes of what we are shortly going to experience in New York. More than 2,700 fires have thus far burnt this year. That's 14.7 million acres of land, and that's a record, about 15 times the normal burn this time of year. There are still 330 active fires. About 78 of them are uncontrolled, and these are large multi-thousand acre fires. DEC Forest Ranger contingent just returned from a fire in northern Quebec on a 2-week cycle and reported out on some of the incredible sizes and conditions that they were facing from these fires. There is some rain in the forecast for Quebec. It's not all of Quebec, but some rain with, unfortunately, some thunderstorms as well that may provide some relief over the next few days. However, we need to turn to the air quality forecast that we are shortly going to experience here in New York. The rain has kept the smoke largely at bay in the last few days. Tomorrow and Thursday, we expect that to change. A cold front is entering western New York from the northwest early tomorrow morning. That will reach downstate by tomorrow evening. The winds, as part of this cold front, are expected to bring significant smoke from the upper Midwest into New York State. DEC and DOH have issued an air quality health advisory for fine particulate matter, that's the PM 2.5 or the smoke particles, for Western New York, Eastern Lake Ontario, and Central New York. This is for tomorrow. So for Western New York, that's Cattaraugus, Chautauqua, Erie, Genesee, Niagara, Orleans. For Eastern Lake Ontario, it's Cayuga, Jefferson, Monroe, Oswego, and Wayne. For Central New York, that's Allegheny, Broome, Chemung, Chenango, Cortland, Delaware, Southern Herkimer, Livingston, Madison, Onondaga, Oneida, Ontario, Otsego, Tioga, Tompkins, Schuyler, Seneca, Steuben, and Yates. The air quality is forecasted to reach the unhealthy zone, and that is in the 151 to 200 range. So air quality will be in that unhealthy zone for everyone, not just for people in sensitive groups. In Eastern Lake Ontario and Central New York, the forecast is unhealthy for sensitive groups. So that's in the 101 to 150 range, as we all have become accustomed to these ranges. That is the unhealthy for sensitive groups range. The rest of the state, the entirety of the rest of the state, is not under an advisory, but it's in the moderate zone, so 51 to 100. So that's that yellow zone. So Commissioner McDonald will speak to that in detail in a moment, what that means for people. The advisories, I think, as everyone knows, are based on 24-hour forecasted levels. There will be spikes. As we saw last time, several weeks ago, there will be spikes during the day that exceed the 24-hour average, possibly into the very unhealthy zone of 201 to 300 or above. Thursday, looking ahead now, again, we are 2 days out from Thursday, so the forecast is less than certain. We are expecting the smoke to move into the Hudson Valley and potentially downstate into the New York City metro area and Long Island. There again is still some uncertainty as to that, but we certainly expect that smoke to continue its march through New York State. We expect most of upstate to be in the unhealthy or unhealthy for sensitive groups range on Thursday. So again, that's most of New York State. If that happens, if our scientists are certain of that, we'll put a new advisory out tomorrow morning in regards to Thursday. I do urge everyone, as we got into the habit of doing last time, to check our website, dec.ny.gov, where we publish maps, or of course, go to airnow.gov to get the most recent information for your particular area, zip code, or town. And now I'll toss it over to Commissioner McDonald to discuss the health impacts of what we will be seeing. Commissioner?
Yeah, thank you so much, Commissioner Seagos, and it's great to be with everybody this afternoon. So let me talk first about the why this matters, and then we'll talk about what you can do. And I think it's important to remember, yeah, we went through this on June 6th, 7th, and 8th. We had that brief event, and I think this is going to be somewhat similar in that regard to that event as well. When we think about this air quality index number, though, I think these numbers are quite frankly new to most of the general public. Generally, the higher the number, the worse the air quality. When we talk about 150 or higher, that really means the air is unhealthy for everyone. And this is what we're anticipating in particularly the western and central part of the state tomorrow. What I mean unhealthy for everyone is, keep in mind, there's certain people that are higher risk. And when we talk about the why, it's that particulate matter. You see that number PM 2.5. What happens is with that particulate matter is we breathe it in, gets into our body, goes down our windpipe into our lungs. When it gets into our lungs, it can cause inflammation. It can cause infection, and it can trigger people with asthma to have a problem. People who have chronic obstructive lung disease can have a problem. People who have heart disease can have a problem as well because it's now into their lungs, and that's not what we're looking for. Keep in mind, bigger particles will be filtered out by our nose, but it's these really tiny particles that are really a concern for people. And that's the why of this is a concern, because it can really impact your lungs. This is why if you must go outside when the air is unhealthy, we talk about wearing an N95 mask. I happen to have mine with me. So, this is one of those things we just have to keep on our person now is an N95 mask when the air is unhealthy. So if you must go outside, this is a really simple intervention that most of us know how to do. I think the other thing that's part of the why is I've downloaded the Air Now app, and I think that you can get this on the Apple Store or the Android app. I have mine programmed for where I live in upstate New York, but I also have a program for all the places of New York because as a state health commissioner, I look at the state every day to see how the air quality is going. And I think these are just important tools. So you've got your app, look at the air quality. I do this every day now. Then I've got my mask in case I need to go out. And I think this is one of those things where it's just really important to understand the why. We're trying to keep ourselves healthy. Last time we saw this, June 6th, 7th, we did see a small spike in people going to the emergency department for that one day. We saw a spike in the New York City area. We saw a spike in the rest of the state. It wasn't something that was normal, which is all, a near doubling of people going. But there were small 3-digit numbers in New York City and then a mid-sized 2-digit number in upstate New York. What we're trying to do is really not see any change in that level at all here. Now, we do monitor the syndromic surveillance for the people who go to the emergency department every day. It's part of our normal monitoring of the state. So we'll know in a couple of days if there is an impact for this. But why we come forward and talk to folks is so we understand the risk and then understand what you should do. So what you should do is, hey, do I need to go outside today? If I do, I wear an N95 mask. I want to stop there because I really want to leave plenty of time for questions today. Thank you so much.